Friends, welcome back to allornonelaw. Guys, this is a medical video lecture, internal medicine. And today's topic of discussion is an important criteria for pancreatitis. That's Ranson criteria. So we're gonna discuss about the Ranson criteria related to USMLE examination, and this is very important for USMLE Step 2 CK and for a Step 3 examination. So before starting a discussion on this, I would request you to subscribe to our channel and please do not forget to share our videos with your friends. Okay, guys. So let me quickly start this. So we're gonna divide Ranson's criteria into two types. One is for non-gallstone and another is for gallstone. Okay, right? So let's talk about the non-gallstone first, then we'll move on to for a gallstone later. Okay, I'm gonna give you the admission over here. Okay, on after 48 hours or around 48 hours. Okay, right, guys? Excellent. Now let's see what you need to do for a, what you call for what you call for at the time of admission. What you need to do is just measure the five is what you call five important things you should look for: age of the patient, more than 55, okay, WBC more than 16,000, okay, AST is what you call, sorry, okay, WBC AST is liver enzyme more than 250, okay, LDH, okay, LDH more than 350, and glucose more than 200. Okay, guys, so these are the things you should look for around when you admit the patient with acute pancreatitis for a non-gallstone. So you need to look for age of the patient more than 55, WBC more than 16,000, okay, then AST more than 250, LDH 350, and glucose more than 200. Okay, so there is some mnemonic for that. You can remember Georgia law. Okay, G is glucose, A is AST or age, L is for LDH, A is for age, W is for WBC. Okay, you can remember this GLO. Okay, now after 48 hours, what you need to look for is look for these three things. One is the hematocrit, HCT. Okay, HCT drops more than 10%. Okay, drops more than 10%, very important. Okay, BUN, okay, increased by 5, okay, increased by 5, remember, 5 milligram per deciliter. Calcium less than 8, okay, calcium less than 8. Albumin less than 3.2, okay. Fluid sequestration more than fluid sequestration more than 6 liters, okay. and a base deficit or a base excess, base deficit is more than 4 millimole, okay, or 4 milli equivalent per liter. So guys, these are the things you should look for around the 48 hours, and there's also a mnemonic for that. And C hops, you can remember C hops, okay. Alright guys, so C is for calcium, H for hematocrit, O for what do you call PaO2, that's nothing but you can remember the PaO2, okay. And then we have BB is a base deficit, okay, BUN, and S is for fluid sequestration, okay. Right, and another thing sometimes they mention as a PaO2 less than 60 millimeter of mercury, PaO2 PaO2 less than 60 millimeter of mercury, okay guys. So remember, this can be also be included in this during the 48 hours of Ranson's criteria for non-gallstone. So let's move on to the gallstone for a, what do you call, for a gallstone, Ranson's criteria for gallstone. So if you want to look at here, we're gonna change only few things over here. Age gonna be 70 over here. For a gallstone it's gonna be 70, okay, and WBC count will be around 18,000, okay, and AST will be the same, more than 250, and LDH will be more than 400 this time in gallstone, okay, and glucose will be 220, okay guys. So did you get me? During gallstone the age of the patient will vary from 55, not it's gonna be 70, WBC 18,000, AST 250 is the same, LDH is 400, glucose is 220, okay. And after 48 hours the HCG drops by 10% in gallstone Ranson's criteria, and calcium is remain the same, the what HCG remains the same, fluid sequestration, what do you call here there it was 6 liters, here it will be around 4 liters, 4 liters, okay, for 4 liters, remember, okay. And a base deficit here is a 4, there will it will be a 5 in a gallstone Ranson's criteria, 5, okay, base deficit, okay guys. So and BUN increased by 3 or more, okay, here is a 5, it's increased to 3 or 4 in what you call gallstone Ranson's criteria. So this score what do you call, it gives whether it's what you call mortality of the patient. So if the score is less than 2, then the mortality is 1%, okay. If it's 3 to 4, then it's 15%. If it's 5 to 6, then it's gonna be 40%, okay. If it's more than 7, it's gonna be 100%, okay guys. So this is Ranson's criteria. So thank you so much for watching this video. Thank you so much. Please do not forget to subscribe, and please do not forget to share our videos with your friends. Thank you. Take care.